My colleagues, we have returned from recess. We will continue on with Senator Therese. Your amendment has been passed out. If you can please speak about it.
Thank you, Mr. Chair. Mr. Chair, so we are currently in the first chapter of the bill, which talks about revenues, and we have projected, and I want to thank OFB for all their hard work on this. What they have described as conservatively, we have, estimated the amounts that the government of Guam will bring in for fiscal year 2020, and. The rest of the bill, of course, appropriates all of those amounts. Another part of the bill also appropriates lapses from 2019 and different things. And we've also appropriated special funds. But right here on this section 4 of the bill, we are talking about revenue collections in excess of what we project. And we've learned from 2019 that right now it's August 2019, the fiscal year ends on September 30, 2019, and we've learned that they are currently projecting approximately 14 million in excess of what revenue the legislature last year predicted would come in. So, but the thing is, despite what the needs might be, the government is unable to spend that money in 2019 because we are told that, we just haven't chosen to do that. And I think, of course, we've seen some legislatures in the past increase the revenue projection by, millions of dollars in hopes of bringing in, additional money. And I know that that's one way to skin this cat, Mr. Chair. We could increase the revenue projections today and be very optimistic and say we're going to bring in more than what we've projected so far, and just like what we did this year. But I think that's, I choose to be, I guess, more conservative than that, Mr. Chair, and because I want to be consistent with your efforts in that regard. So all I am trying to do by this amendment is to say that when BBMR and DOA and Rev and Tax prepare that report that shows us that we are actually collecting more than we predicted to collect, that we then take that extra money and we lock it up. And we lock it away from transfer authority, we lock it away from expenditure for prior year obligations, we lock it away from expenditure for even disasters, Mr. Chair, because we're putting it subject to legislative appropriation. And I feel like this is the only way to ensure that the legislature is going to have authority over that money. And so I've called the fund that we're going to put it in the Hospital Capital Improvement Fund. And that is because, it's well known that this budget does not cover the capital improvement necessities for the hospital, even the 3 most urgent ones, including the roof, the electrical panel, and that electronic data program that they insist that they need this fiscal year, that they will get no other extension from CMS or the Centers for Medicare, that they will not get an extension on that, and that needs to be done this year. Now we, have, this does not give them that money. My amendment doesn't even give them that money, however, Mr. Chair. What it does, it locks the money up until we can be assured by Guam Memorial Hospital as well that they are ready to go with these projects, that they've done all we've asked them to do. For example, with the electrical panel, that they've They say now GPA is looking into it again, that they've exhausted all other avenues of fixing the electrical panel without expenditure of this money, that they've exhausted all other avenues of obtaining insurance proceeds to fix the roof, and that they've exhausted all their avenues as to finding the most efficient and cost, value for the government in procuring that new electronic data program. And so we're not giving this away to GMH either. I think, we need to also hold them accountable. And, but I just think we can't look the other way, Mr. Chair, when we know that the needs are there and they're described as critical to us. And there's so many more, but those are just the three top, and that those total $21 million, which I think is way above the amount that even in 2019 they're predicting for excess revenues. In other words, even by setting this money aside that I described here, that is described in Section 4 of the bill, even by setting that aside, I don't think we're going to have enough money even for the top three projects at GMH. But what I'm hoping is to at least either we find $10 million for that electronic data program that they say they need to replace this year to start them off, or that the money's safeguarded and if it's needed somewhere else that's more urgent. So right now, for me, I think this is a way for the legislature to kind of put its foot down and say, we're going to take care of this money and make sure that it goes to the best use. Because this is money that's not appropriated in this bill, and it's money that in 2019 we're told, we're going to wait until the end of the fiscal year to see what this really is, but it's already August. And we could do that, Mr. Chair, but if we are receiving this money in the middle of 2020, and the hospital needs this money in the middle of the 2020, then I think that we should decide in the middle of 2020 how much is available in there and decide whether that's the urgent need or not. But I just think there are all kinds of uses that without an appropriation, this money can go to. And so that's what I'm worried about, Mr. Chair. So that's why I say it's a protection for the legislature to ensure that the money's not spent anywhere else. And if the administration really needs it someplace else, then that can easily be justified and the money's locked up so the money can be appropriated elsewhere if that's a more critical need than the hospital's capital improvement, Mr. Chair. Thank you.
Senator Chulai, I just, because you continue to make that statement that it just be locked up, does anybody have any comments or any statements to make to this amendment?
I just have an inquiry, Mr. Chair, if I may.
Yes, Speaker.
Just based on the amendment as read, and I understand where the good senator from Jonia is asking for, but it says how fiscal 2020 income tax and business privilege tax revenue collected per month in excess of the revenue projected for that month. So, Mr. Chair, has there been a budgeted breakdown for each month projected for the income tax and the business privilege tax set aside for each month?
Based on our projection for 2020, we actually have a revenue estimate for each month that we're estimating 2020 revenues to be based on. We have that information, yes.
And if I may add, Mr. Chair, the CRER, that report that we are mandating in Section 4, that's what we're mandating them to do, is to set amounts
Yes,
for the
that's
different
why I'm
months
asking.
based on what they might see.
So, if you have an actual projected breakdown, can we get a copy? I know there's a CSR report, but I'm asking if you're saying there's a set aside for that amount,
Yes, Speaker, what it is that we have data. That's how we projected the 2020 revenues. We have that in our spreadsheet, in our worksheet. We don't have it readily available for disbursement because it is in spreadsheets and worksheets that we use. So, and that spreadsheet it'll actually detail how much money we anticipate to collect every month based on historical trend. And that's how we came up with the 2020 figures. I hope that answers your question.
No, it doesn't, Mr. Chair. At this time, I was hoping that if we're anticipating that, to set aside this funds to be in that separate lockbox, I'm hoping that if we've already set that aside for the projections, if there's what will be accumulated for the projections based on 2020. So do you have that set aside?
If you're asking if we have revenue figures on a monthly basis, is that your question? Because we have the revenue figures on a monthly basis of how we derived each revenue category.
So
We
what
have
comes
that.
in January, Mr. Chair, what comes in February, what's projected to come in March, all the way down. So I'm saying, do you have that set aside? Because for me to support the intent of the bill, I'd like to see what we're looking at in as far as what's going to go in on a projected level. So can we take yeah, Mr. Carlson may have something.
Yes.
I just use a legislative term, point of clarification. Senator, if we read your amendment, you are looking to section, I would imagine it's all of the taxes, which include corporate, individual, withholding, and the BPT. So are you looking at the gross or the net? Because we have general fund of 803, and then we net out the provision for income tax refunds of 125 million. We net out the pharmaceutical fund of 19.4 million, and then the Harmon Industrial Park roadway of 250,000. So is your intent to look at the entirety of these tax categories, hopefully from a net perspective, not a gross?
Yes, absolutely, as a net. And I'm trying to follow the format. I had first written them out individually, but with all the exceptions, so I just decided to take the categories from page 2 so that it would be net, yes.
Okay.
That's the intent.
Lester, hold on. We're on page 6. We'll stay on 6. We are not going backwards. So we're not discussing anything going before 6.
Yeah.
Your amendment is for line,
Line 18, to add a
line-
new, in there,
line
line 7.
18?
Line
Where-
22.
It's actually line 22?
Line
correct?
22 or 23.
Line 22 or 23, page 6.
Right. So, Mr. Chair, just
Okay.
based on that and based on what the presentation by BBMR is, I want to take a moment's recess
Recess,
just to
yes.
confirm. Si Dios masi.
Recess. Colleagues, we have returned from recess. I think the question that the speaker want to pose
Mr.
to
Chair,
the panel?
Thank you very much, Mr. Chair. Again, thank you for the moment's recess to try and speak to the panel that's presented before us. And Mr. Carlson, maybe you can answer this based on what OFB has stated. The provision as proffered in front of us states that revenues collected per month in excess of the revenues projected for that month for both categories combined shall be deposited in. And if I'm not mistaken, based on a previous conversation, you spoke that usually when you're looking at the excess, you usually tag it at the end of the fiscal year. And maybe you can explain further on that and let me try and understand, because as we look at this amendment moving forward, I do know that the hospital need for capital improvements there's 3 major categories, but I also know that there are other agencies who've come up with concerns about needing additional funding from what's being provided, and I want to make sure that we look at all avenues and get an assessment of what are we looking at in as far as amounts that may be recovered.
Thank you, Madam Speaker. We are deliberating and discussing the FY 2020 fiscal year budget for the whole year, which contemplates the receipt of revenues collected in sometimes very irregular fashion, and sometimes only in like spurts, like with the property taxes. You've got your first and your second installment, right? There was some discussion that we had before the lunch break, where Mr. Byrne and I expressed that if this amendment was fashioned to reflect amounts over those adopted in these categories at the end of the fiscal year, that would be consistent with provisions that this body has passed, similar to the collection of Section 30, because let's say Section 30 for discussion purposes is 75 million. So we got the 75 million, and then before the war claims, sometimes we'd get another 6 million, 10 million of, from efforts that we've spent years to seek reimbursement on. The provision is very clear. Once you hit the adopted revenue level, anything in that category goes, in the case we're talking about, to refunds. So this is the concept of the amendment is not unlike what the legislature has passed previously, but it must be predicated upon the closing of the fiscal year and the attainment of the revenues, not just on a monthly basis, but if BPT is going to be 315 million, we might be ahead in 1 month and we might be below in 6. You never know. So at the end of the fiscal year, once we know what we collected and it's over what was adopted, then we can look at things like this, but certainly not month to month.
Not on a month-to-month. So, Mr. Chair, I will just reserve my comment, and I hope that my other colleagues will chime in on this so that I can hear their sentiments, but also know that if the concern. Okay, Mr. Byrne?
Madam Speaker, if I could put it in a kind of different way, As Mr. Carlson said, collections are irregular. And the way this is drafted, if we were to be very efficient, if DRT were to be very efficient and collect taxes early, for instance, if taxes were collected on June 28th that are actually due July 1st, for example, this money would then be, as drafted in this amendment, the money would be siphoned off and left in this fund, even though it's going to be needed to meet July expenses. So as drafted, this seems very difficult to operate. Mr. Carlson's suggestion of waiting till the end of the year would even out all those collection issues. I would also like to point out that if you appropriate everything that comes in, and this does that, we will never ever reduce the deficit because we're appropriating out of the general fund everything that comes in over the projection.
Thank you, Mr. Byrne. Thank you, Mr. Chair.
Thank you, Madam Speaker. Senator Clinton Ridgell.
Thank you, Mr. Chair. So just to be clear, just to get a clear understanding of this, as written, the amendment, my understanding is that it would require any excess revenues projected in a particular month to be set aside. So with that, and what I'm hearing you say is that if we do that, if there's any sort of anomaly in a quarter, for example, say, for example, the first quarter, there's a great month because of some anomaly, or maybe, as you suggested, people paid earlier, you collected sooner. So there's an excess in revenues collected over what was projected for that month. But say in the following quarter, there's another anomaly that causes a reduction in collection significantly. It can be any sort of happening. We've seen it happen before, for example, with North Korea when it made threats to Guam. That quarter and the subsequent months were very poor in collections compared to what was projected. So without having that excess revenues there to offset any potential deficits in the future of that fiscal year, it could theoretically result in a shortfall at the end of the fiscal year. Is that correct? Sort of being below revenue projections at the end of the fiscal year. Is that correct?
Yes, cumulatively that could happen. You know, collections are cash, and cash comes in irregularly. And what this does is take out all those variations that are to the positive, but doesn't account for anything that might show a negative cash collection. Like I said, if a collection is early and it hits one month rather than the other, there's nothing there, there's no mechanism for adjusting for that.
Thank you. That's a little bit concerning. That sounds like it could create difficulties as far as the cash management perspective is concerned as well, correct?
Yes, Senator.
Mr. Chair, also, if I may ask if the author of this amendment would yield to a question?
Senator Therese, would you yield to the, state your question.
Does this amendment create a new fund? This hospital capital improvement fund, is that a new fund?
That's correct. I'm just creating another fund that it's going to be separate and apart from all others, yes.
With that, I have a follow-up question as well. Shouldn't the creation of a new fund be subject to a public hearing?
Senator Therese.
What I think should be subject to a public hearing, Mr. Chair, is if we're going to use this money. And that's exactly what we're trying to do with this amendment, is to put the money someplace. We could put it into an existing fund, but I just thought it would be very clear for all of us and all of our purposes if we put it into a new fund, something that no one expects to use. And I think it should be subject to a public hearing if we're going to take any money out of this fund. For example, if there is a shortfall for some reason, if there's some kind of anomaly, that's exactly what we want to know, Mr. Chair. We want to know when there are anomalies in our government. We want them to be accountable. This is the way to hold them accountable so that we are told if there's First of all, they make their projections of revenues every month based on what they expect, based on also all the anomalies for different months. They don't set the same projection for every single month. They are different. If you look at the CRERs, their projections are different every month based on what they expect, when they expect the land payments, land taxes to be paid. And quite frankly, Mr. Chair, in FY19, if you look at it the way that I've drafted this amendment, I've combined the income and the business privilege taxes together with all their anomalies, together with the negative corporation tax in 2019 versus the positive in the other income tax categories. I've combined them together so to cushion from those anomalies. So they've got so many different, I think, cushions, and that all this will do is put the money aside. And I absolutely agree with the senator who I've yielded to, that yes, a public hearing should be required when the money gets taken out. And that's what I'm afraid of, is if we don't put this money into someplace special, we will not know when it is used, when it is, when they use it for some other purpose. That's the whole point, Mr. Chair. Thank you.
Senator Clinton.
Thank you, Mr. Chair. I understand exactly what my colleague is attempting to do, and I commend her ideas. My concern is that this is something that to me seems like, well, let me pose a question actually to the members of the panel. Is these excess funds, at the end of the fiscal year, they should be reflected as a surplus, right, each month? If there is truly excess funding, at the end of the fiscal year, there should be something reflecting a surplus at the end of the fiscal year, correct?
Yes, Senator, in the absence of any extraordinary liabilities, yes.
I guess what I'm saying is, if there truly is an excess in revenue collections over revenue projections, there will be a surplus shown to us at the end of the fiscal year by way of the CRER reports and by the way of the closing out of the fiscal year, correct?
Yes.
At that time, would it be more prudent at that time to then take a look at the surplus funds and look towards appropriating it to something like this?
Yes, Senator, it would.
Thank you.
Any other senator colleagues would like to speak on this amendment? Senator Torres.
Thank you, Mr. Chairman. I'm looking at the amendment, and specifically it's calling for income tax and business privilege tax revenues collections per month in excess of the revenue budgeted for that month. And what I note when I look at the amounts that are contained on page 2, for the income tax, the projected income taxes for fiscal year 2020 is $276,958,194. For the business privilege taxes estimated to be collected per annum, it's $372,277. The combined total of those two tax categories is $577,030,471. What I wanted to clarify is, of that $577 million, what is also reflected in the following page is that the available for appropriation from that category, and including others, is only $645 million. So what essentially we're proposing with this amendment, and can correct me if I'm wrong, is any time that we have an anomaly where in any one given month there's a budgeted amount and we collect in excess of that, we're going to lock that excess up into this fund for the hospital capital improvement. If the following month there is another anomaly and the collections is way down, then we in essence just operate on a deficit that month. So month to month, there's no way of really safeguarding the government or taking advantage of the ebbs and flows with revenue collections. So in looking at the fact that we're now going to bind based on really is an anomaly. Anomaly is an anomaly. I mean, there's no rhyme or reason to it, and there's no security in it, and I think there's great risk in it. If you're looking at 577 million of 645 million that's available for appropriation, we're really now contemplating the lion's share of the revenues that under this scheme would not be used at the discretion of the governor to take care of what the government or the governor's office deems most in need at any given time to be funded. But we're in essence looking at putting all of the excess into one operation of the government, which is health. Is that a fair assessment of what the effect of this amendment is?
Yes, Senator, your assessment is basically right on the mark. If you notice that if you're talking about the two categories here, income tax involves the withholding income tax and corporation, and business privilege tax. Those two categories represent 90% of the entire government of Guam revenues. So if this proposed bill is to set aside any excess on a monthly basis, like several speakers mentioned earlier, that, one thing about revenues, they come in, they're not consistent every month. So what you may surplus one month may end up in a deficit the next month. And so as you go for the 12-month period, you hope at the end of the year, we all like to see a surplus, but we won't know that until the end of the year. But if we start taking and drawing funds out of these funds, these categories, then it's going to make it very difficult at the end of the year to cover any type of shortfalls, simply because these monies have already been withdrawn from the fund and set aside for a specific purpose. Now, I don't know if the fund itself that's being created may be tapped for uses other than the intended purpose of the fund, but I personally would find it very difficult to try to manage the funds as we go along if by month to month we have to reserve the so-called excess funds as they materialize and not be able to utilize these funds at the end of the fiscal year to cover whatever shortfall we may experience and run into. But you're absolutely right, Senator.
Because after all, Mr. Guerrero, the governor has the prerogative to use her transfer authority or to assign certain funds to whatever project is needed, including the hospital, which I know we've done in the past, more or less, right? So there's nothing to prevent best case scenario for GMH from occurring if we do experience more revenues above and beyond this conservative projection, from what I can see. You would agree?
Yes, you're correct.
Point of order, Mr. Speaker, point of information. This does not affect the governor's transfer authority because it does not affect any of the appropriations that are subject to her transfer authority. All of those are already covered.
Mr. Carlson, you want to make a statement?
I don't believe that was an accurate statement. If the monies are taken as the amendment states monthly, then it's going somewhere and it's unavailable for her to utilize. So I don't believe that statement was accurate.
Mr. Carlson, is the governor able to use excess revenues right now or able to transfer excess revenues right now based on her transfer authority?
Yes.
So
But-
she can transfer in excess of the appropriations amount?
No, no, no.
That's what you're saying.
I didn't say that, you said that. What I said was that you said this doesn't affect her transfer authority. If the ebbs and flows basically result in monies being put in this fund when we could have used it 2 or 3 months later to even the resources to keep the government operating, then she doesn't have anything to use because it went into the fund. You locked it.
I don't understand what you're saying. If she receives all her appropriations, she can transfer those up to the 15% that she's authorized in this bill. This doesn't touch any of those. It touches what's in excess of that.
No, it doesn't.
That's what
No, it
the
doesn't.
intent is, Mr.
Well,
Carlson.
that might be the intent, ma'am. God bless you for the intent, but the language is contrary to the intent, with all due respect.
Do we have any other colleague would like to make any comments to the amendment? Senator, Vice Speaker.
Thank you, Mr. Chair. Perhaps just a housekeeping measure, a point of order that to keep this a very civil engagement, that we direct our comments to the chair and that the panel likewise as well. Thank you, Mr. Chair.
Thank you, Vice Speaker. There being no other comment, Senator Lai, would you like to close?
Absolutely, Mr. Chair. And I just want to clarify a couple things. First of all, our OFB chair has told us that we have made appropriations of revenues in this bill, or we have made estimates of revenues in this bill for 2010. And we're guessing, it's a total guess, what the revenues are going to be, right? But OFB and BBMR have both come in here and said we're being conservative, that these are our best estimates, and I think that we can rely on that. And if you look at FY 2019, we were very conservative and we brought in a lot more revenue than they actually predicted. Now, what happens to that excess revenue is really the question here. And many people want to talk about the ebbs and the flows. Well, if they're doing their job right, they're predicting the ebbs and the flows. Unless we have a super disaster, a big anomaly, and if we have those, then good thing if we have put some money aside and we are going to be able to use it to accommodate some kind of disaster in our economy. Otherwise, if everybody's doing their job and they're bringing in the revenue they're supposed to be bringing in, and hopefully bringing in more revenue if we increase our tax collections, if we increase our tobacco tax collections, if we bring in our bread and breakfast tax collections, if we do those things that we're supposed to do, we're going to be bringing in, hopefully, a lot more than they've even predicted in this budget. So we're going to be bringing in excess revenues, just like the at least $14 million in excess revenues that they're going to end up with in FY 2019, that they are telling us we cannot use, despite the hospital sitting over there with an electrical panel that does not work, that they tell us is critical to the safety of the people in the hospital. It's that kind of logic that really doesn't make sense to the people of Guam, I think, Mr. Chair. And maybe, call me crazy, but I just can't see why we're going to let the excess revenues go to anything, to the unknown, like Mr. Burns said, to some kind of, I even had to write it down, extraordinary liabilities. Well, what are those? We should know exactly what those are before the money goes there. And if they can justify it, then the money will go there. At least that's the intention, unless the fund gets raided for something. And otherwise, if it's needed for that electronic data system that the hospital says it is needed, and that we have no other way, I've seen no other plan to fund that electronic data system that they said CMS is requiring by the end of 2020, then I just can't see the hesitation, Mr. Chair. First of all, we've got conservative revenues. And if they get their revenues, then the governor can transfer all she wants from the 15% of those appropriations, of those revenues. It would really be an exception if we take all of the taxes, all of them combined, the ones that I've outlined, and if you combine all of those that we're going to come up negative, then that's a serious different economy, not the one we're looking at today. So this scare tactic of, we might have 1 month that goes down. Yes, we might in one category, but not in all, hopefully. And the fact is that in 2019, if you take those categories and you combine them and you look at every single month for 2019, we came in positive. And that just takes that little bit of positive extra that has not been vetted before the people of Guam as to how we're going to spend it, and puts it into this fund and locks it up so that the people of Guam will know where it's going to be spent. And they won't be told at the end of the year or when you finish your audit that actually we did spend it even though it was excess and there was no appropriation. We spent it because we could on prior year obligations, on some kind of court case settlement, on all those other kinds of things, which are also legitimate. So I'm not questioning that you're going to spend it on that, but I'm saying those are the expenditures that the legislature can never get a handle on. They can't see. And so that's all I'm asking is if we want accountability for expenditures in the government, then we've got to stand our ground here in the legislature and demand that we're going to see those things.
Thank you. Do you have anything else, Senator Therese?
One more thing, Mr. Chair. If we wait until the end of fiscal year 2020, that will be October 1, 2021? Is that correct? In 2020. October 1, 2020. The hospital has told us, notwithstanding the electrical panel or the roof or all of the other $57 million in capital improvement that they've requested, they've told us that their estimate of $21 million for that electronic data program, that is an absolute requirement for CMS by the end of the year. So if we wait until the end of fiscal year 2020, which is October, and they need it in place by December, I just think we're being foolish. This at least gives us a shot at it. As opposed to having to go out and borrow, I just say we just put the money aside right now and see how much we can come up with to settle that, Mr. Chair. And this is not even some extravagant pay raises. It's not for additional hiring. It's for something very necessary. No one has proven that it's not necessary. CMS is actually the one who's insisting that the hospital gets it. Otherwise, I'm sure we would, try to see our way out of that. But it's a CMS requirement, Mr. Chair. Thank you very much. And I ask my colleagues to please consider this. This is a time for us as the legislature to put our feet down and let's just hold the government accountable and show the people where the money is going to be spent. Thank you very much, Mr. Chair.
Thank you, Senator Therese. I have two of our colleagues raise their hand for an amendment. Senator Lee, and then followed by Senator Shelton.
Thank you very much, Mr. Chair. I think a majority of my colleagues everybody in this room could agree with many of the statements made by the previous speaker, by the proffer of this amendment, but I'm just not sure if the language that's been presented to us will help to accomplish that goal, or if we're able to do that. My question for the panel is, and this will help to inform the amendment that I would like to proffer, and I know it's been answered in one way or another, but if I could just maybe get a more direct response from maybe Mr. Carlson or Mr. Byrne. At what point do we know these revenues to be excess? So if you're saying on a month-to-month, based on our projections, it could be a positive or a negative, I just wanted, what would you say is a safer assumption in terms of, this is requiring, the language in this amendment requires that all funds due or accruing to the account from whatever sources is provided or authorized pursuant to applicable law, inclusive of any interest, shall be deposited in the fund immediately upon receipt by the government of Guam. And I think maybe that's the contention that we're having here, is it's from what I'm hearing from the panel, it would be either impossible or very difficult to deposit those monies directly into the fund immediately upon receipt. It doesn't give us that room. So again, at what point do you feel comfortable identifying these revenues as excess?
Senator, I think Mr. Carlson said that he didn't feel comfortable arriving at a number of excess revenues until the end of the financial year. But my concern, overriding all that, is that the timing of cash flows we cannot control. In fact, it kind of penalizes you for collecting money early because it then disappears out of the general fund. I certainly wouldn't want to tell DRT, please don't go out and collect these taxes because I'm going to lose them to the general fund. That would be a really a reversal of sensibility in the matter. So the way this amendment is drafted, if we did collect early and we didn't collect it the following month, it would be lost to the general fund and it couldn't be spent by all the departments that are dependent upon the general fund.
Thank you, Mr. Byrne. Mr. Chair, I'm going to just have a conversation with legal. You can take questions from other colleagues, and I'll be just working on an amendment.
Mr. Chair, I thought you asked me to close on my amendment.
Yes,
I'm
I understand.
open to
And
amendment, but very
their hands went up immediately after I asked you to close. And even Senator Shelton wants to do an amendment. Unless there are objection by the body that you don't want to accept any more amendments to this, we can motion to go to the vote of the amendment. But there are amendments. Well, no, I'm going to ask if there's any objection. If the body does not want to hear anyone else's amendment, even though I asked the author of the amendment to close, because I saw hands go up right when she started talking, that means they wanted to do an amendment. And I wasn't going to rudely interrupt her and say, stop. So I'm going to ask the question. Does the body want to entertain amendments? Yes. Okay. So could I have a show of hands, all in favor of hearing amendments? Of hearing amendments to this amendment?
No objection.
If there's no objections, motion carries. So we'll continue. Senator Amanda Shelton.
Thank you very much, Mr. Chair, and I really appreciate this amendment from the proffer of this amendment, Sijuas Masi, and I think, as the previous speaker said, we can all agree that the hospital is one of our priorities, but I think that we can see that in the last couple of weeks, we've had a lot of talk about the need to address some shortfalls at the University of Guam, and we continuously hear about the Department of Education. So I'd just like to offer an amendment so that we can make sure to address another one of our priorities in the government, which is education. So I'd like to offer an amendment to change the name of the fund to the Hospital Capital Improvement and Education Fund. Simple.
Do you have that written down so everybody can see that, Senator Shelton? Why don't we take a short recess while we get that written up so that everybody can see exactly what you want, what my colleagues want. And Senator Lee, do you have your amendment? Okay, let's take a short recess. We have returned from recess. Senator Shelton?
Assiduous Masi, Mr. Chair, before the recess, I discussed an amendment that's been passed out to all of our colleagues, and the amendment is to read, this is a change to the name of the fund. Subsection A of this section shall be deposited into the Hospital Capital Improvement and Public Education Fund. For purposes of this section, public education shall include the Guam Department of Education, University of Guam, and Guam Community College.
On the motion to further amend, is there any member who wishes to speak? Senator Therese?
Thank you, Mr. Chair. I'm not going to object to this amendment because I think, it's folly to pit health versus education, of course, versus public safety. But I think if you want to look at what, we pledge out there and where we put our actual money, it's a whole different story. And I think there are many of these needs that have been taken care of or we're trying to take care of in this budget. Not all, but across all agencies, not all needs are taken care of. And I know everybody's saying, well, we want to debate whether it goes to the hospital or not. Well, the status of the hospital is that it's receiving less for operations than it did last fiscal year. We're having a Medicaid change, and MIP is short. We have a lot of unknowns as far as the hospital is concerned, Mr. Speaker, and we have those, they've given us the 57 million that we're not even entertaining. We're not even looking at that. We're only looking at the top 3 and how we're going to fix the top 3 projects. So when I was calculating it out, if 2020 is like FY19 and things go great like they did in FY19, then we might end up with a $14 million shortfall or less. I can't imagine more. But what the hospital's asking for that one project alone is $21 million. That's really the reality. So, I'm not going to argue, but I just think if we're going to put our money to the hospital, then let's put our money to the hospital. And if we're going to put our money where our mouth is, then let's do that. And it's just hard to keep being pitted against each other. And they're different projects, Mr. Speaker. Some are capital improvement, which is what I'm proposing, as opposed to expanding operations beyond what you and OFB have already predicted is necessary. Thank you, Mr. Chair.
Thank you. Thank you, Senator Therese. Are there any other members who wish to speak on the amendment? To the amendment?
Mr. Chair, point of inquiry. So is it possible to put aside the lapses for the end of this year towards these critical projects of the hospital? Has those funds been dedicated already?
Your question again is, Senator Sabina, one more time?
So I think one of the issues with this amendment is that we won't know the full picture of excess funds until the end of the fiscal year. Well, the end of this fiscal year is coming up. Is there a way we can dedicate that funds to funding these critical projects at the hospital?
Senator Sabina, the amendment, let's follow
Mr. Chair,
let's follow the amendment first, and then we can move.
If I could just speak on that, Mr. Chair, point of information.
Okay.
In my review of the budget before us, there's a provision here for the use of lapses from fiscal year 2019 towards public safety. There's a provision for lapses from 2020, which means...
Ma'am, what page are you on so that our colleagues can follow whatever...
126, section 24, and there's a provision for the lapses from 2020. If I understand this correct, yes. Part of it goes to the rainy day fund that they amend in this bill also, page 129.
So your statement is on page 126, ma'am, is 126, section 24. And what was the other page, ma'am?
Page 129.
129, which identifies, you're talking about line 6, section 22904? Is that what the one you're talking about?
It looks like, I mean, this is talking about appropriations versus expenditures and what comes in over that. So it looks like lapses to me, Mr. Chair, on page 129.
Okay.
That's for 2020, though, and like I said before, for the hospital, that might be too late. But the 2019, unless we're going to amend that other section, that's
I guess
So
when we,
that's why
when we get there. if
right.
you
Well, that's
wanted to
why I'm
amend that.
trying to find a fund that's not already tagged in this bill for something else.
All right. Senator Sabina, did that answer?
Yeah, I believe we're going to, I guess, revisit the conversation when we get to that page.
All right. Senator Clint, you had your hand up.
Yes, thank you, Mr. Chair. Just with regards to this amendment, I think the amendment is just further amending the special fund. So I believe there is still a problem with creating a special fund without having a public hearing on it, and now we're just adding to that special fund by creating an even bigger special fund, again, without having a public hearing. That is all.
Thank you. Senator Amanda, are there any other members who wish to speak on the amendment, to the amendment? Senator Castro.
So just a point of information for the main author of the amendment, Senator Terlahi, if you will. Stated in your amendment.
Senator Castro, we're still on the amendment, to the amendment. We're still at Senator Shelton. We haven't got
I'll
to.
stand by. I'll stand by.
Okay. Does any other member wish to speak on the amendment, to the amendment? There being, yes, Vice Speaker.
Thank you, Mr. Chair. I just wanted to, can I make an amendment to this present amendment? No? Until this amendment passes, right?
That's
Okay.
correct. Okay,
I'll stand by.
okay. So, we'll move on, my colleagues. There being no other, Senator Clinton, you have comment for, wish to speak on the amendment to the
Yes,
amendment?
just to be clear, I object to the amendment to the amendment.
Okay. Senator Shelton, would you please do the honor of closing? Just move? Okay, on the motion to further amend, there is an objection. Oh, ma'am? You want to close now? Okay, that's what I asked you earlier.
Thank you, Mr.
Thank
Chair. I just want to say that the intent of this amendment is not to take away from the hospital, but for us to also address the other priorities of the government, which we all went out and campaigned on, okay? Health, education, safety. I don't need to remind any of our colleagues that these are things that we talked about every single day and that people come to our offices to ask about. And so as we move forward, I can't sit by and not include the Department of Education and the University of Guam and GCC, who for years on end have not received their full allotment, and not think about making them whole moving forward. So that is the purpose of this amendment here today.
Thank you, Senator Shelton. There being an objection, all in favor of the amendment to the amendment, please raise your right hand. Motion fails. Now, to the amendment, are there any members who wish to speak on the amendment before I ask the author of the amendment to close? And there will be no more speaking after that. Okay? Senator Castro, you raise your hand first, and then the Vice Speaker will be following.
Thank you, Mr. Chairman. Mr. Chairman, it's a point of inquiry for the author, and then depending on the response, I'd like to follow with some comments on the amendment. So for the author, you list here on the fourth line, ma'am, hospital capital improvement. So traditionally, when I think of a CIP, I think of any long-term structural change to a facility, maybe even at times a major investment in a major piece of equipment, something well over maybe $100,000 with an extended depreciation schedule. Could you just explain to me what the intent is? I heard you reference the IT system, ma'am, and I'm pretty familiar with that project. So would this fund be restricted to the information technology system?
Senator Therese, you?
Sure, thank you, Mr. Chair, and thank you for the question. By this amendment, no, there's no restriction on how it's going to be spent, except it's subject to appropriation by the legislature. So the intent is that it may not even end up at the hospital if some other emergency comes up that can be, argued is more important. But my intent is to set it aside so that we already know what we're looking at in liability for the hospital, and in order to have a plan to get that done during 2020, I'm trying to get that money set aside. So at least we have a plan, and we have that ready to use if they come in and they're ready, right, for their electronic data program, which again, like I said, is critical for CMS. The hospital in their budget request gave a $57 million list of capital improvement projects that they say they need. But there were 3 that they line itemed as urgent. So the EDP, the electronic data, is just one. The other one is the roof, and the other one is the electrical panel. Now, I'm hoping we're going to find solutions for those others soon after this Army Corps of Engineers looks at the building. But in any event, whether we build a new hospital or we don't, some of these things need to be addressed immediately if we're going to continue to take patients there. And the hospital has told me that regardless of whether we want to build a new hospital or we don't, this electronic data program is necessary, and it's necessary in 2020 again. And that cost was approximately 21. That was their first estimate. We're hoping they're going to come back with a lower estimate. But it doesn't look like it's going to be anywhere below 10 million. Thank you.
Senator Castro.
Mr. Chairman, with that said, I don't have any problems with the stated intent, but the amendment as written, in my opinion, limits, at least as far as the language as I read it, limits what we can do with the monies. And actually, I think a healthier debate can be had on the priorities of the hospital. I agree with the retiring speaker that the IT system is important, as much as I agree that addressing the issues of the uninsured and underinsured are equally as important, especially when taken in the context of accounts payables and those unfunded liabilities, especially when taken into the context of looking at Z-Wing and how demolishing that and rebuilding that entire structure can generate a whole new revenue stream. This has been recommended time and time again, and so while I don't disagree with the stated priority of an IT system, which actually would extend also to Guam Behavioral Health, which is a good thing, I think additional dialogue needs to be had, in my opinion, as far as my vote is concerned, for the amendment on the definition of hospital capital improvement project. Thank you, Mr. Chairman.
Thank you. Does any other member wish to speak on the amendment? Vice Speaker.
Thank you, Mr. Chair. I'd like to make an amendment to the amendment. And I'd just like to delete the sentence that states, and it's somewhere towards the bottom of the paragraph, all funds due or accruing to the account from whatever source as provided or authorized pursuant to applicable law, inclusive of any interest, shall be deposited in the fund immediately upon receipt by the government of Guam.
So you wanted that whole sentence deleted?
That's correct.
Okay.
And so the reason for this deletion is Perhaps it's a little bit, perhaps we're being unrealistic upon the immediate requirement. And so I'm thinking maybe we can be more realistic if we remove this requirement and see if we can move this forward, because we do see examples in the budget where there's instances of lapse funds. So just to allow the agency to be able to meet this intent or this goal to ensure that the hospital gets fixed, it's worth a try.
Thank you. Could we get that in writing?
Just to save paper, Mr. Chair,
Okay.
just strike it out.
Just strike it out?
So
Okay.
if my colleagues can follow along with me, it's towards the bottom, it's the last, about second to the last sentence. If we can just strike out the sentence that reads, "All funds due or accruing to the account from whatever sources as provided or authorized pursuant to applicable law, inclusive of any interest shall be deposited in the fund immediately upon receipt by the government of Guam." So if we can just strike that sentence out, so just to save paper and the interest of time also. Thank you, Mr. Chair.
All right. Are there any? Right. Does my colleague understand where the amendment's at? We're all in agreement, right? Okay. Now, are there any other members who wish to speak on the amendment? Senator Tello?
Thank you, Mr. Chair. Mr. Chair, I'd just like to ask the author of the amendment to the amendment. All funds due are occurring to the count from whether sources is provided here. What's the difference from the time that it's recognized that there is excess revenue? The reason why it can't be immediately put into a fund? I don't understand.
Vice Speaker, do you yield to the question?
Yes, Mr. Chair, I do yield, as we've been going back and forth during this dialogue for almost about an hour now. We're requiring a lot from the agency to do this immediate action. The projections and the appropriations for this quarterly execution or monthly execution didn't seem realistic. And so to find a middle ground, I wanted to propose this as an option, perhaps.
Thank you. Senator Tello, did that?
Well, actually,
Can I answer
I
it?
see what the good author is talking about, but then if it's not immediately, where's the time frame in which it should be deposited into the fund? If the intent of this legislation is to deposit any excess revenue into this fund, then when do you do it? If not, if it's been identified right then and there. So I'm not quite sure. Maybe I can ask the original author, the author of the first amendment, what the intent was on when to take this excess revenue and put it into the account. If I can, to ask the author of the...
Senator Tello, we'll do that when we finish dispose of this amendment first. And then we'll get to her amendment, which...
No, it's not her amendment. I have a question for the original author of the amendment. Yeah, to allow, ask what is the intent of when will it be deposited into the account if it's recognized as additional excess revenue, and BBMR or DOA recognizes it, when do you put it in the fund? So my question is, what was the intent of the original author for when it goes in? If not immediately.
Senator Therese, the author of the original amendment.
Thank you for the question. I'm not sure I can actually, well, I don't have any objection to removing this sentence because I think the sentence above it still says they shall deposit, and it talks about what they shall deposit. So I think it's implied that when they have it, they deposit it. And it calls for it to be, revenues in excess of what they've predicted for that month, according to subsection A, which requires them to predict for that month. So I just think, I'm not sure when they do that. I know they do the CRER like the month after they actually, or sometime during, how that accounting goes. It's after the 30th, they give themselves a few days to do the accounting on it. So I have no objection to that.
Thank you, Mr. Chair, because, Mr. Chair, the way I see it, then they can hold off, the administration can hold off, for Department of Administration or BBMR can hold off until the end of fiscal year to deposit. That's what I'm saying. That's all. It doesn't tell them that when they have to put it in, so it's, by striking this out, they can wait until the end of the fiscal year. Thank you, Mr. Chair.
Thank you. Vice Speaker, do you want to close on your amendment to the amendment so we can move on? Or?
I'm okay, Mr. Chair, thank you.
On the motion to further amend the amendment, are there any objection? No objection, motion passes. Now to the main amendment. Or Senator Kelly, did you want to speak on the amendment, the main amendment, or no? Do you? Do you want to speak on that one? Okay.
Sujus Maasi, I wasn't able to be here for part of this coverage over this amendment, but I believe no one has asked the question of when the last time was we've had a supplemental budget. Was there a gathering?
You're asking when have we ever had where the body submitted a supplemental budget or was asked a supplemental budget? Is that what the question?
Okay.
Oh, I don't. Maybe BBMR or DOA can ask that question? Was the last time that they had a supplemental budget?
It's been a long time.
Well,
Maybe 2013, Jason thinks it was then. I actually think it was later than that, like.
but 2013 isn't that long ago. The 80s is a while ago, but
Yeah, but it's been a while.
so I wanted to ask, we've been talking about different approaches. Of course, there are these different priorities, and I can't imagine absolutely anybody here who doesn't want to see the capital improvement projects happen for the hospital and money further going to our public education systems and things like that. Do you find benefits in an approach like calling for a supplemental budget where we do indeed come back and formally revisit these sorts of issues rather than trying to do this all at once now and waiting all the way until again next August? Do you see benefits from your past experiences perhaps in us getting together again and addressing some of these issues, excesses that we know are stacking up or funds that are tracking rather well, and being able to re-gauge the fiscal climate?
We have a mechanism such as that was employed in 2018 as a result of the Tax Cuts and Jobs Act, where we came before the body to be able to revise the fiscal 18 budget. As far as a supplemental request, I think my prior statements in both the public hearing and earlier on are consistent with being able to try to plan appropriately for the fiscal year. We believe that once we adopt the revenues, that we should be able to forge ahead without the need to be so conservative that we have to come back mid-year when there's still potentially something out there that we didn't capture. I did suggest to the body in my testimony to consider upward general fund revenue adjustments, but apparently that didn't get any traction. So it's better for somebody to have good revenue assumptions, attainable revenue assumptions, to undertake the entirety of the fiscal year.
Senator Kelly.
Oh, so Sidua Masi for that. And I think definitely we've been working towards understanding what is attainable and trying not to fall into some of the patterns of having situations such as appropriations occurring and then it being very crippling to that agency or entity when those appropriations don't come fully to fruition for a variety of reasons. So definitely we're working in that balance. And I just am feeling that there might be positives in knowing that we can come back as a body if we need to make adjustments, if we need to revisit, because we have so many things that are important right now. If we look at this, we have public libraries, most of which are only open one day a week, and our community desperately needs institutions like that. We have our behavioral health and wellness that could do with more funding, and they're at the forefront of some of what we're trying to combat here. So we have all of these needs, public health itself and others, DISIT, firefighters who need appropriate uniforms for the fires that they fight. And I guess my one worry is, with all these many needs, as noble as, well, I would say they all are, to move too much into just one direction without the ability to revisit and make sure that we're balancing all of our needs, that we're not leaving our people with disabilities behind, and we're not leaving those that are at the forefront of fighting our drug abuse issues behind, that we have that chance, if there is monies, if there are found to be monies, we have a chance to come together and revisit it all together and make sure it's balanced, rather than forging ahead on a singular path that locks out other opportunities. As noble as that path is, there are these other noble causes as well. And so I just want to express that concern and point out that we do have those kind of opportunities to revisit our budget and potentially put together a supplemental budget if we need to.
Thank you, Senator Kelly. Are there any other members who wish to speak on the main amendment? I will now ask Senator Therese to indulge us for closing. Ma'am.
Thank you, Mr. Chair. I appreciate the second opportunity for this. But seriously, I just want to try to allay the fears of my colleagues who've been, expressing this concern that the government will not be able to operate if we put aside the excess revenues that we are not appropriating. If we just put those aside and lock them up, the government is going to be able to operate on the appropriations only. That is the goal, Mr. Chair. It's to keep them accountable, to operate within, what they've been appropriated, not anything more. And the other thing I want to say to hopefully allay some of their fears is that with those appropriations, the governor has 15% transfer authority by this bill. Also by this bill, the legislature, if this bill is passed as it is going to be setting aside 2%, I think that's what it is. Yes, 2% of the total revenues projected for the general fund for that fiscal year to the rainy day fund, which will be used for general fund deficit reduction. And this bill, if it is passed, is also prioritizing the payment of tax refunds. And if there's any other more critical need, this amendment will have this money set aside and, in effect, hopefully locked up for that need, for our determination, for the legislature's determination of that need in front of the people of Guam, and not some need that's determined by, behind closed doors. And Mr. Chair, this is not a luxury that I'm asking. It's actually an emergency. It's actually, like I said, we're not even asking for all the $57 million for capital improvement for the hospital, and I hate to keep repeating myself, but this is very important, this part. It's for a CMS mandated need, that CMS has put a deadline and that there is no other plan to pay. And as we have seen, the legislature has reacted over many years to CMS needs. We are not taking care of all the CMS requirements by any means. What we are doing is addressing that one fire, that $21 million, that's what they're estimating fire. Hopefully, but I don't even, if we look at 2019, that's way optimistic. At 2019, we're hoping we're going to see some 14 million, but I'm not that optimistic. I think it's going to be less. So I'm just saying whatever it is, even if it's $1 over the appropriations we're already putting in this bill to take care as much as we can with all the other agencies, we at least put that extra $1 aside to try to address this CMS mandated emergency. And if I may just remind everyone what CMS is, it's that Medicare. It's that accreditation for Medicare that if the hospital doesn't have it, we're finished. They will not pay Medicare. That's the result. That's at least what they've come down here year after year. Even before I became a senator, Mr. Chair, this is not my issue. But they've come down here every year and said, if we don't take care of this CMS issue, they're going to stop paying us Medicare. We're not qualified to take Medicare anymore. And that's a huge amount of where they expect to get income, not just for this year, but for every year. And so this is an emergency that there is no plan for right now. And not even the rainy day fund shows that they're going to take care of that. And I think the rainy day rightfully says they're going to take care of deficit reduction. And so this is a plan for something critical. And I hope that I have allayed some of the fears, and I just think, please consider that, of course, anyone else outside the legislature would want to keep the power of that money for themselves also. Because, that's like the name of the game at this point. It's who gets to control expenditure of the excess revenues. And if we want to control the expenditure of the excess revenue, and we want to be able to keep everyone accountable for that, and to do it in a transparent fashion, then, this could be called any fund. I called it the hospital fund. That's all I did. I did not appropriate the money anywhere out of this fund. This amendment only puts it into a fund. And if the legislature finds another more critical than CMS need, then please, by all means, take it out and put it there later when the money gets in there. But right now, we need to get the money in there. That's really the goal. And I'm afraid that they have tried in the past to mandate the executive branch to come back and show us what are the excess revenues so that we can do a supplemental appropriation. But like they've said, that has not worked out for years because it's because of what we've seen. They wouldn't even allow $150,000 out of the excess revenues to be spent for, that autism bill, saying we won't know the excess until the end of the year. So unless we put this money here in this fashion, they're going to lock that away from expenditure until the end of 2020, and it's too late for GMH by the end of 2020. That is really my concern. So please, I'm asking my colleagues to please consider those things, and I hope that you can be assured that if it wasn't a critical need, believe me, I am also the oversight chair of behavioral health and other agencies that budgets did not see a cent increase this year. So they're all critical, but this CMS is really something that cannot be ignored. And if the administration has another plan, then by all means, let's hear it. But in the interim, this amendment should be harmless. It just takes excess revenues, non-appropriated revenues, and puts it aside. Thank you, Mr. Chair.
Thank you, Senator Therese. On the motion to amend, are there any objections? There is an objection. All in favor of the amendment, please raise your right hand. 2, 3, 4, 5. Motion fails. Do we have any questions for section 4 of page 6? Section 4, page 6. Yes, Vice Speaker.
Thank you, Mr. Chair. Mr. Chair, I have an amendment. Well, we might have to change it to letter C, because I wrote this thinking that the previous amendment would...
Do you have the amendment ready circulating, ma'am?
Yes, it's already circulated. It's to add a new subsection D to section 4 of chapter 1 of the bill to read. But can we just make that a new subsection C? I'm sorry, I thought I was following the previous amendment just in case. So it'll be to add a new subsection C to section 4 of chapter 1 of the bill to read. Department of Public Works, Guam Highway Fund, all funds in excess of the adopted revenue levels as enumerated in Roman numeral 2, letter M of section 2 of chapter 1 of this act are hereby appropriated for the improvement of village streets and roads.
All right. Senator Tello, you're also partner to the amendment? You want to make comment? Because I was going to ask the panel to speak for point of information if you want. Oh, but go ahead, please, Senator Tello.
But I don't have a point of information for the panel.
Well, Mr. Chair, I'll yield to the author of the amendment to give her point of information, and I'll reserve my right after.
No, I don't have a point of information for the panel, so I don't need a response from them.
Okay.
This is the amendment that I'd like to move
All right.
forward. If there's any concerns that my colleagues have, I'd like to address. Thank
Senator.
you.
Senator Tello, you want to make,
Yes.
or would you like a
Thank you.
recess to
Yes,
converse?
Mr. Chair, why don't we recess? So
Okay,
don't
we have
to
a few-minute
go over this.
recess.
Yeah.
We've returned from recess. I think we left off with Senator Tello. Am I correct, Vice Speaker? You were done, so your partner in your amendment, Senator Tello Tadui. Ma'am.
Thank you, Mr. Chair. Mr. Chair, last week, Friday, we had a discussion that I proffered an amendment, but found that it would probably make more sense, and for the sake of, be financially accountable and ensuring that whatever additional revenue, excess revenue is collected, it's done so and put in a place that I was hoping the $1 million that I made to increase our revenue, but unfortunately I didn't get the support. But the good author came up with a great suggestion, and I fully support this amendment. But Mr. Chair, Mr. Chair, this section recognizes that in the event additional highway fund revenues are collected, that the proceeds are used to help fix broken roads throughout our villages, and that many of our residents have continued to bring to our attention, including potholes, uneven surfaces, street repavement, and so much more. This amendment commits any additional revenue that may be realized in FY 2020 without jeopardizing obligations that are funded through this budget. So, Mr. Chair, that being said, I'd like to thank the author for allowing me to be a co-sponsor on this amendment, and I'd like to make just an amendment to this amendment, Mr. Chair. I don't have it in writing, but it's real simple. It's at the beginning of the letter C, and it's just as simple as saying, notwithstanding any provisions of law, Department of Public Works, Guam Highway Fund, all funds in excess of the adopted revenues levels. And then, Mr. Chair, also further down where it says, I hereby appropriate, I'd like to insert to DPW, Department of Public Works, for the improvement of village streets and roads. So this is just a simple amendment to show where the appropriation goes. So once again, for my colleagues, it's at the beginning of C, notwithstanding any provisions of law before the Department of Public Works / Guam Highway Fund, and then on the last last sentence, are hereby appropriate and an insert to the Department of Public Works for the improvement of village streets and roads. Thank you, Mr. Chair.
Thank you, Senator Tello. We're under assumption that both authors are in agreement of that amendment to the amendment? Okay. Does anyone, any member wish to speak on the amendment? Senator Lee, Regina Lee.
Point of order, Mr. Chair.
Yes, ma'am.
We are on the amendment to the amendment. I wanted to make sure that there was no objection to the amendment to the amendment.
Oh, okay. Are there any objections to the amendment?
To the amendment.
Okay, you want me to... Could you please restate the amendment?
To the amendment.
To the amendment.
So to restate the amendment to the amendment, Mr. Chair, it's very simple on letter C. Right after letter C, before the Department of Public Works / Guam Highway Fund, to insert notwithstanding any provisions of law. And then on the last, or the second to the last line at the end, where it says, are hereby appropriated, then we insert to Department of Public Works, and then it continues for the improvement of village streets and roads.
Are there anyone wish to speak on the amendment to the amendment? Senator Lee, did you want to speak on that one? Senator Clint?
Thank you, Mr. Chair. I just want to be sure that we're putting in language in this section, the revenue section, where we're putting in appropriation language. Should we not be putting in appropriation language in the appropriations section?
I can yield, Mr. Chair.
Beg your pardon?
I can yield to that question.
Okay.
Thank you, Mr. Chair.
Vice Speaker?
It was clear that, that if we were, I was actually saving this provision for the miscellaneous provision piece. However, I went through legal and I asked them within this bill, where would be the best place to put this, amendment? And the legal said that to identify the revenues, you would put it in section 4.
And also a point of information, Mr. Chair, as well.
Excuse me, hold on, son. Could you repeat that one more time? The legal has advised you the best place to put it is where?
It was in section 4 because we were discussing the revenues.
Okay. Senator, you want to yield to that also?
And a point of information as well, Mr. Chair. We also spoke with BBMR, and we will probably be, well, I'll be proffering another amendment in the section of page 139 that speaks directly on Department of Public Works and incorporate the same type of language to be consistent. But that will come when we get to page 139.
Just a point of order, Mr. Chair. Can we just make sure that we can move this amendment forward or not?
Yes, I was trying to get to that, so Senator Clint, did that answer that question? Does, no, that's what we're talking about. Are there any members who wish to speak on the amendment to the amendment? None. Are there any objection to the amendment to the amendment? There being none, amendment passes. Now back to the original amendment. Are there any members who wish to speak on the amendment, with the amendment? Senator Lee.
Susan Smasi, Mr. Chair. Mr. Chair, I rise in support of this amendment. I do have a concern that I just wanted to register on the last line where it identifies improvement of village streets and roads. I think DPW in many of their rules and regs, their policies, and all the language that they use in terms of street and road repair, they identify the listing of like federal routed roads, secondary roads, tertiary roads, and I just want to give our legal bureau the opportunity to potentially amend this section so that we can make sure that we are addressing the right pieces of roadway on Guam. So I'm not sure if village streets and roads complies with that same language and will match up, but I just want to make sure that the intent of this amendment, that it follows that. One of the things that has been brought to my attention is the fact that we do have routed roads on Guam, main thoroughfares, particularly in the south, that are really in desperate need of repair, Mr. Chair. And I think it's really important to note that while these roadways are traveled by many thousands of our residents, they are technically routed roads, but they fail to meet some of the qualifications for federal highway, federal monies. And one of those being rights-of-way issues. And so one that kind of comes to mind is the seaside area in Alahan, right by Papanizuk. And so I'm just concerned, we've heard reports from people in the community that many people, many motorists have to kind of swerve out of the way and even onto oncoming lanes in an attempt to avoid extreme damage to their cars because this road is in a desperate need of repair. So I think, I want to support this amendment because I think it does that. And as long as we are very clear about this being funds in excess of the adopted revenue levels, and we're citing exactly where that is, I certainly want to support those efforts, but I do want to just make sure that our legal bureau is able to put the right language in the end of this amendment in terms of village streets and roads, or if we should identify it as secondary and tertiary, or I'm not sure what the best language would be. So I'm just going to ask that question, and you can continue on to other members. This is just Masi.
Thank you. Does anyone else, any other member, because I know we do have your amendment, Senator Reese, so before we get to you, Senator Clint, one minute, Senator Reese. Senator Clint?
Oh, yes, I just support what the previous speaker said, and I would like to echo those sentiments to ensure that this funding can also go towards the main roads in the south. I live down south. I travel those roads all the time, particularly from everywhere from Surfside and Talafofu all the way through Malolo. Just try driving down that area all the way down to Inarahan, the Papa Ninzuk store that the previous speaker was mentioning. So I do want to make sure that those roads can be repaired as well with these funds. In addition to that, I'd also like to request for a brief recess so I can look at some language that I'd like to add to also include that this funding can be used to help mitigate against flooding problems in the south as well along the roads, and particularly in Malesu and in Alohan.
All right. Thank you. We have an amendment also to this amendment that was proffered by Senator Therese. You're gonna not? No. I'm gonna. While they're walking around, this may have an impact, ma'am. So, would you want to speak on that one? On the amendment, because you have an amendment to the amendment. So, beg your pardon? No. I'll let you speak first, and then we'll recess so that Senator Clint can get whatever he needs to get.
Point of order, Mr. Chair. I think Senator Lee has the amendment that she was discussing.
Oh, you
earlier.
have the information? Okay. So why don't we start review before we get to Senator Teresa's amendment? Senator Regine.
Thank you, Mr. Chair, and thank you for accepting this amendment, not written and passed out. It's just 4 words that we're going to be including to the last portion of this amendment. So the amendment as proffered ends with "are hereby appropriated for the improvement of village streets and roads." And my amendment would be to add a comma there and the words "whether routed or not," period. So just 4 words, and I think that encapsulates all the things that we're trying to achieve with this amendment. I thank the proffer of this initial amendment and ask my colleagues to support.
I just like to ask, can you explain whether routed or not?
Yeah, so we want to
What do you mean?
ensure that these excess revenues are appropriated for the improvement of roads, village streets and roads, whether they're routed roads or whether they are not. So even routed roads that are not available for some of these federal monies to improve them, we want to make sure that they're included in this. To Masi. And that's the recommendation from legal.
Let's definitely take a recess. I need to speak to legal about that verbiage. Thank you. We have returned from recess. Senator Lee.
Sejos Masi, Mr. Chair. Mr. Chair, I'd like to withdraw my previous amendment to the amendment and replace it with different language. It's also about 4 words, so I hope my colleagues will bear with me. So this would amend the last part of this amendment to read, funds in excess of the adopted revenue levels are hereby appropriated, as enumerated in 2M of Section 2, Chapter 1 of this Act, are hereby appropriated for the improvement of, and then replace the words village, streets, and roads with these 4 words: roadways, highways, roads, or streets. And I think that encapsulates everything that we're trying to address here. We're not sure exactly how much of the funds will be in excess of the adopted revenue levels, but we're hoping and praying that it'll be at least enough to help improve these roadways and keep our residents safe on our streets.
That's a
Sejos Masi.
motion to withdraw your amendment first, right?
Yes, motion to withdraw.
Any objection? No objection.
And then my motion is to add, for the improvement of roadways, highways, roads, or streets, period.
So that's roadways, highways, or streets. Or streets, right? Highways or streets.
Roadways, highways, roads, 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 or streets.
Okay.
And the reference for this is we pulled the language from 5 GCA, section 53101C in the definitions section. So we just wanted to make sure we
Okay.
were consistent with what's already in GCA.
Does
Sejos
any,
Masi.
does any senator wish to speak to the amendment? None? Senator Therese?
I understand the intent of the amendment, Mr. Chair, and I commend the intent of the amendment. And I understand the frustration with the mayors and everyone really that the highways are not being repaired as quickly as they should be. The problem is, yeah, I don't want this money to be, this is just a very small amount of money. And the way they budget them out, like per roadway, per mile, so few roads get repaired, even with the increase in the fuel tax. And so the mayors and DPW in past years had made the plan of which roads they were going to prioritize, not including highways. And earlier when DPW came in this year, they said they were going to stick to that list. They weren't going to depart. They were not going to come up with an all-new priority list. And I don't know, asking them to redo that, that may be okay, and then maybe they can do it quickly, but I remember the last study, it took money and a lot of time, and it's actually, we've been trying to get them to get it done, even that same list that they've been looking at for years. And I'm honestly just worried about the reason that they're not doing the highways. And that has always been, for the South, ownership of the roads, right? We don't own those easements necessarily from Jotnya to Malasu, right? And so I just think with the little amount of money that we have here, I want to see those inverse condemnations done. And I tried to do, we did do an information or oversight hearing, when I first got in regarding that. And the AG's office position is that these can be done anytime. And we are doing them whenever anyone comes in with, you have to come in with your inverse condemnation claim against the government, and the AG's office supposedly will take care of it, right? The problem is they don't have a fund to pay that. And I guess that's what I'm wondering. Federal highway funds can't pay that part, the condemnation part or the inverse condemnation part. And I'm not sure if this amendment is intended to use these funds to do that, which I wish we could, but I feel like this amount will not be enough. So maybe we won't even get any roads done. So only for that reason, I prefer that DPW sticks to its plan, sticks to the priorities that the mayors have already set out. They have like the 3 top priorities, and that they get those done, because they've been eyeing those forever. And I don't know, because I don't want to say I don't want the highways done. Of course, I mean, I live there. I want them done. I think for safety, they need to be done. But I think we, as a legislature, we have to look at where we're going to get the money for those easements, and that's another great use for the set-aside of excess revenues, Mr. Chair. I'm just joking on that part, but I just want to show, yeah, that's a huge amount. And, you know, I'm just thinking, if you pay the easement for just one small portion of that road, it might take up the whole amount. Yes, thank you.
Thank you, Senator Therese. Does anyone else like to speak on the mention? Then I'll ask you to close on your amendment. Does anyone else, any other member wish to speak on the amendment to the amendment? No other? Senator Lee.
Thank you very much, Mr. Chair. The purpose of amending in this way, and I want to ask my colleagues for their support on this, is just to make sure that we give DPW as much latitude and as much wiggle room as possible to get the things done that they deem worthy and what they think is the biggest detriment to the safety of our residents. And so I just ask my colleagues for their support on this. Sidus Masi.
Thank you, Senator Regine. On the motion to further amend the amendment, are there any objections? None. Motion passes. We will now move to, if anybody else would like to speak on the amendment to the amendment, because I know that Senator Therese has an amendment. Senator Rizal first, because I wanted to get to your amendment, ma'am. I did? Okay, then, Senator Rizal.
Thank you, Mr. Chair. I would just like to amend the amendment after the word improvement to just add the word and flood mitigation. Add the words, excuse me. 2 words, and flood mitigation after the word improvement. So it would read improvement and flood mitigation of roadways, highways, roads, or streets.
Senator Rizal, that's the amendment as the amendment to the amendment. Okay. Does anyone want to speak on that? The amendment as amended. Senator Therese.
Thank you, Mr. Chair. So for the addition of the words flood mitigation? Yes. Yes. I support that amendment, Mr. Chair. I think it's an excellent amendment to this bill, and I'm not sure how much is going to be needed for that also. I know that Bureau of Statistics and Plans earlier in the year announced that they were going to take care of the Barcenas flooding area. So I surely hope that they can still find a way to get that done. They were working with, I think, the Army Corps of Engineers, and that they find funding. But otherwise, if that's not possible, then yes. And there's a lot of other flooding areas in these places, Mr. Chair. So excellent amendment. I commend the author.
Thank you. Does any member want to speak to the amendment as amended of the amendment? None? Senator Rizal, do you want to close on that, or?
No, thank you.
Okay.
Just I ask for everyone's support.
All right. On the motion to amend Senator Rizal's amendment to the amended amendment, are there any objections? Motion passes. Now, Senator Therese Terlai, you have an amendment, ma'am, to
Thank you, Mr. Chair. Well, I want to speak on the the original amendment proffered that's before us.
First?
Yes.
Okay.
So, first of all, I want to support this amendment. I stand in support, or I support this amendment, Mr. Chair. It looks like it's intended that in addition to what we are appropriating in this bill for highways and actually for village streets and roads and now highways and flood mitigation, that we are also going to take the excess of adopted revenues for fiscal year 2020 and put those also to those roads. And so it's a great idea. All of the extra money in 2020 should go to those roads. However, Mr. Chair, I would like to make a motion to amend that amendment as I've passed out. And this is strictly for the sake of not waiting until more than a year from today to see that money and to put it towards the roads, but to put it towards those roads as soon as we can get that money. And this is Guam Highway Fund. It's a special fund, and we have made the appropriations out of it. So I feel like once the money comes in and it's excess, then I would like that to be available to DPW. Because like I said, this stuff it's slow. I mean, you know, we've seen them spend the money, but it seems slow. So I don't want to wait a year from today for them to get that money. If they can get it when it's available, I think that's when they should get it. So my amendment is just to, instead of saying in excess of adopted revenue levels, you know, for 2020, it's saying yes, it's saying the funds collected on a quarterly basis in excess of the amounts that are budgeted in subsection A, Mr. Chair. And if you read subsection A is requiring BBMR to budget out our revenue projections that we're adopting in this bill for 12 months. And so in that budget out that they do, they are supposed to accommodate, you know, fluctuations that they can predict. For example, if, you know, they can predict some type of fluctuation in this Guam Highway Fund that, you know, based on what's paid when, and or just from what they've seen in prior years. So that's what I'm saying. If it's in excess for, now this one says on a quarterly basis. So I'm hoping that that's sufficient time for them to see that they've got excess for this quarter, and why hold on to it or allow it to be used for anything else instead of just putting it to exactly where the original amendment wants it to go, Mr. Chair, as soon as possible. Thank you.
You're going to speak to the amendment? Senator Tello.
Thank you, Mr. Chair. Mr. Chair, I stand in full support of this amendment. You know, I've been working with the mayors and meeting with them and even providing them with a survey that I've created in my office on the issues they have with roads. And, you know, they brought these surveys back to my office. Almost all of the mayors have done this and showed me their biggest concerns. And this is definitely a way to help get this money to them so they can address these issues. Of course, it's a lot sooner than, I would like to have it a lot sooner, like as soon as this budget is passed, like I proffered the amendment, but this is just as good, Mr. Chair. It brings responsibility as well as allow the administration to review on a quarterly basis. And I spoke with the author of this amendment and putting something like in this type of language in the amendment, and I greatly appreciate her work on this. Thank you, Mr. Chair.
My colleagues, I'll allow one more speaker because we need to break because the media needs to reset. Senator Lee, you have something real quick?
Thank you very much, Mr. Chair. Just a question for BBMR. I just wanted to know if BBMR issues a monthly breakdown of how much you might think that the Guam Highway Fund will collect each month. Do do you issue that? I just want to make sure that if this amendment moves forward, that you're able to tell us how much.
Yes, we do. It's on your special fund report under the Guam Highway Fund. The most recent report, we have a projection for what we think August and September are going to bring in. But
Thank you, Mr. Carlson. Mr. Byrne, could you tell us if, for whatever reason, the Guam Highway Fund isn't meeting these projections on a monthly basis? And I just want to kind of wrap my mind around if the cash is available to provide this in time. Do you think that this language will be enforceable? Are you able to make this happen?
Senator, you're talking about next year, 2020, right? You're talking about next year, 2020, right?
Yes, so I guess the thinking is that all of the funds that are collected on a quarterly basis in excess of the revenues that we are attempting to appropriate here, I just want to see if that would be, if you'd be able to identify what excess revenues are on a quarterly basis, and how long that would take you to turn it around.
Yes, I mean, that would be possible, but I would point out, pardon me, I would point out that the highway funds, as has already been pointed out, go off in different directions. So we would have to, I guess, sort of draw up an accounting of the highway fund at the end of the quarter to determine what indeed was excess, because of the way the highway funds are divided up. But yes, we could do it if that was the will of the body.
And Mr. Byrne, should this amendment pass, once you identify what those quarterly excesses are, how long would it take you to make sure that that, I guess, is set aside?
We would probably be able to do it at the end of the month following the quarter. But I guess I would ask, Senator, just like I did on the general fund, if there was a deficit in the following quarter, how would we make that up?
Well, that's something that we'll need to think about. Thank you, Mr. Byrne.
Thank you. Senator Clinton.
Thank you, Mr. Chair. I appreciate this amendment to the amendment, but I have the same concerns I had with the previous amendment, in that it's doing a similar thing where it's capturing these funds before the end of the fiscal year when the books can be completely resolved and we can know exactly what funds are available for appropriation. So I think the way the first amendment was worded didn't do that, but I believe that this amendment to the amendment then sort of restricts the funds and captures any excess funds, say in the first quarter. Am I correct? Can I ask the fiscal team if that's what this amendment to the amendment is accomplishing?
Yes, you may. Lester.
Your interpretation is correct.
Thank you. So for the same reasons I objected to a previous amendment, I'll have to object to this one as well. Thank you.
Does any member wish to speak on this amendment? No, you don't want to speak? Okay, Senator Therese, if you can.
Thank you, Mr. Chair.
Nobody else speaks. Senator Therese now. Thank you.
As the panel has indicated, for 2019, the Guam Highway Fund, they appropriated in 2019 $22.8 million. The Guam Highway Fund has actually already brought in, or is tracking to bring in, $25 million. So what we are doing in this bill not by this amendment, but by this bill, is taking whatever's excess in 2019 and then appropriating that to DPW. And that's what the original amendment would do. It would take what is excess in 2020 and appropriate that on October 1st, 2020 to DPW. But I am just saying, if there is a mechanism that allows us to take that money earlier and put it to DPW, then what are we waiting for? When the roads are in the condition they are in, if the fund has got an excess, that's what it should go for. And it should not wait a year, it should go there right away. Thank you, Mr. Chair.
Thank you. On the motion to amend the amendment, are there any objection? There is one. All in favor of the amendment, please raise your right hand. Motion fails. Ladies and gentlemen, my colleagues, we will recess until an hour and a half, which should give you 7 o'clock, because it's ready after 5. And we will return and continue on with our discussion on Bill 186. Thank you. Recess at this time.